There are some people that struggle with migraines and they keep coming back no matter what they've tried. Various prescriptions, some of them with pretty nasty side effects, almost worse than the migraines themselves. They've tried keeping a list of their triggers and avoiding them. They've tried changing their diet, wearing special sunglasses, and none of that seems to really move the needle. They keep getting migraines that come back. They last for hours, if not days, and it just kind of wrecks everything. Well, for some of those people, the reason they're not getting any results with traditional methods is because their migraines are really rooted in the nervous system and in the upper neck area. There's a really unique connection between the upper neck and migraine symptoms, and that's why there's a type of chiropractic care called upper cervical chiropractic that has a really strong track record of success with helping stubborn and chronic migraine cases. And here's the thing that's important to know about migraines. Migraines are not a simple type of headache. It's not just one thing that happens, not just an increase in blood pressure or a drop in blood sugar or hormonal change. Migraine symptoms are actually a cascade of neurological events that stem from what's called the trigeminal vascular system. It's complex networks of blood vessels and nerves in the brain and brainstem that cause the symptoms of migraines, which is why migraines sometimes come along with things like visual changes or auditory changes or smells of things that aren't actually in the room the person's in. And there's a unique connection between the upper neck and that same trigeminal vascular system. That connection point is called the trigeminal cervical complex. And the nerves from the upper neck, especially the first cervical nerve coming from just above C1, around C2 and C3, the C1, C2, and C3 nerves fire into this trigeminal cervical complex, and it's the same area that the nerves from the head and the neck and the face fire into as well. And it's a bidirectional system, which means to say that problems in the upper neck may trigger that system and trigger that cascade of neurological events that add up to a migraine. And sensory information from the head and the neck and the face, and even internally with certain blood vessels, fire back into that same system. So it's a two-way street. Now, most migraine treatments are focused on trying to mitigate or minimize the symptoms of a migraine, not actually address the root cause or the triggers that will cause that cascade of events to unfold. And one of those triggers is actually an upper neck problem. So how do we figure this out? How do we know if somebody's upper neck is actually causing their particular type of migraines? Because not everyone who comes in with a migraine are we telling them for sure this is an upper neck problem. We need to start to treat your upper neck to help you, resolve these migraines. We have to put people through a screening test. And so the first step in the screening test that we do to figure out this upper neck migraine connection is a functional nervous system test called infrared thermography. Thermography is a very safe, non-invasive, non-triggering way to test the function of the nervous system real time in the office. It's very simple, and the results from the thermography test can tell us if somebody's nervous system is functioning well or if functionally it's kind of stuck or not adapting. Sometimes we call that sympathetic dominance, or they're stuck in fight or flight, which means their internal nervous system is always not adapting very well. They're always tense. Their cardiovascular system is a bit tense. Their HRV is lower than it should be. So we use this thermography test to figure out how the nervous system is functioning. If we see the problem show up on thermography, then we're going to take a very specialized series of x-rays called biomechanical x-rays, focusing on what's happening in the upper neck. Not just x-rays, simple x-rays from the front or from the side that show us a static neck. We actually have the neck bent in different positions so we can actually see if the atlas and axis or the C1 and C2 vertebrae are moving or if they're stuck. If they're stuck, well then that's how we know where to make the adjustment that's causing the neurological issue that we can test with thermography. And so what treatment looks like for these patients is they come in for a series of appointments. Some appointments lead to an adjustment, and many of them don't. Many of them we test, every time they come in, we test with thermography to figure out if the nervous system is still stuck or not functioning well, and those kind of symptoms, that kind of problem will, probably cause another migraine to happen in the near future, or if their nervous system is functioning well. If the nervous system is functioning well based on the testing, we're going to leave them alone. If it's not functioning well, that's when we're going to make the adjustment. How often a patient gets adjusted with upper cervical care is different than regular chiropractic care. It's not just because they're in the office they get an adjustment. They only get an adjustment if the testing bears that out. So over the course of a case for a chronic migraine case that we might be helping, let's say they have maybe 15 or 20 appointments over the course of maybe 3 or 4 months. Only a handful of those are going to lead to an adjustment. Many of them are just going to be confirming the prior adjustment is still having the right kind of an effect. The problem in the upper neck hasn't come back. The nervous system is now shifting its function, adapting back towards normal function, and the person usually notices, hey, my migraine symptoms, they're getting less frequent, less severe. They don't last as long when they do happen. Everything's beginning to calm back down again. So sometimes a chronic migraine problem where nothing seems to be really helping, none of the usual treatments seem to be really helping very much. Sometimes those cases are because there's a massive problem in the upper neck that's not getting addressed. And that's why upper cervical chiropractic care has a strong track record of success with these kinds of cases, because we look where kind of seems not other healthcare modalities or specialties are really looking. It's safe, it's almost, it's very, very effective on cases that we end up accepting, which aren't all the cases because we have to run them through a pretty thorough screening and evaluation initially. But the adjustments are safe, they don't have to happen every time, and it addresses one of the root causes of migraines, which can be in the upper neck.